Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, an infectious diseases expert is calling on the government to reconsider the use of the Dengvaxia vaccine amid the rising cases of dengue in the country. With COVID-19 cases increasing and vaccine coverage still low, at least for booster shots, is it about time to make the booster shots mandatory? And still no health secretary as the country continues to grapple with the pandemic and other health challenges. Former health secretary and Iloilo Representative Janette Garin joins us live. Officials are raising the alarm over higher cases of dengue fever. The health department says 15 out of 17 regions have actually surpassed the epidemic threshold for dengue. As cases continue to climb, infectious diseases expert Dr. Ronchin Solante believes it is now time to reevaluate the use of the Dengvaxia vaccine. The health department says more evidence is needed before reviving the use of Dengvaxia. Let's go straight to the source of the story. We have former health secretary and Iloilo 1st District Representative Janette Garin. Congresswoman Garin, welcome to the source. Thank you so much for your time.
Thank you, Pinky, and good morning.
So let's first talk about the dengue cases. They're up by 90% compared to the same period last year. Undersecretary Vergere calls this alarming. How would you describe the situation we are facing right now when it comes to the dengue cases?
Well, it's really sad that people are still dying from a disease that could have been prevented. We have to go back to the facts. Dengue has no cure as of the moment. It was made and discovered in the Philippines, and we exported it to more than 100 countries. It is continuously mutating, and we have 4 serotypes now that are all known to be deadly. The vector control strategies has long been there. It was started by DOH in 1993, and the World Health Organization has repeatedly said and declared dengue as an international health concern. The problem is that when the vaccine came, the experts and the real science was actually drowned in the debate. And I do agree with Undersecretary Rosette Vergere, but let me just clarify that she is speaking about the current situation now. This will open our eyes to the universal healthcare law, whose intention is actually correct and really for the people. However, some insertions were made into the law, making vaccines, medicines, and even devices inaccessible. And of course, I'm referring to the misconception that all medicines, vaccines, and devices should have to pass through phase 4 clinical trial before it can be given a CPR or a license to operate. So that is where Undersecretary USEC Rosette Vergere is coming from. However, if we look at the whole world, the global regulatory agencies, the whole world dictates that the minimum requirement for a CPR is phase 3A, because phase 3B is for other uses, and phase 4 is actually for post-monitoring and surveillance. In other words, the universal healthcare law, by virtue of those who also complained against Dengvaxia, was able to insert a provision that the world should be using a certain medicine or intervention for approximately 10 years before the Philippines will be able to use it. That is a disaster.
Okay, so before we go to that, that's also very interesting to talk about. There is a call right now to, again, review the dengue vaccine, Dengvaxia. Should government now, at this point, knowing the cases that we are seeing right now, should government reconsider the study and the use of Dengvaxia?
Definitely. Pinky, I am not saying that the government should buy it, but the dengue vaccine, Dengvaxia, which is available now, has been listed by the World Health Organization and the Essential Medicines List, or the EML. Anything that is listed in the EML are medicines, vaccines, and commodities that all governments in the whole world should make available to its people at all times. As I repeat, we are not saying that government should buy it, but for parents who can afford and would like their children to be protected, they should be given the option to buy. For the pediatricians who would like their patients to be protected, they can be given the option to do so. Precise for me to say that when the CPR or the license was revoked by the Food and Drug Authority, they were also very clear in saying it's not a question of safety nor efficacy because that has been long established in the 23 years of trial in 15 countries. However, there was public pressure, mounting pressure, and they pointed at possible admin requirements, which was actually a reason to just revoke the license. So we go back. It was more on the noise outside, silence the scientists, and everybody was just afraid to touch the issue of vaccination.
And when you say noise outside, would you possibly just be talking about the political noise that happened or that was made and concluded due to the use of Dengvaxia? Was it politicized?
To some extent, yes, but it was more of a major action internationally of anti-vaxxers and anti-industry organizations. But the problem here is some of the politicians were not able to look at it in a proper perspective. So people thought that it was all about politics, but no. On the scientific world, it was all about infodemics and the fight between pro-vaccine and anti-vaxxers, and some people clamoring for the naturalistic approach to cure illnesses, meaning it's a group of people who are against industry, and they call WHO and epidemiological numbers as bad science. So that's the problem. The Philippines, the whole world, and dengue, for that fact, has been a victim of infodemics.
Okay, but let's talk about Dengvaxia first. Number one, Congresswoman, is there any other dengue vaccine apart from Dengvaxia?
None that I know of, but there are a lot in the pipeline. I'm not sure if the one from Takeda has already been licensed because I know they were also approaching completion of phase 3A.
Okay, so now let's go back to Dengvaxia. There's a lot of controversy regarding this. You were health secretary during that time. This was allowed during the time of President Noynoy Aquino. And then what happened were two things. One was the succeeding study of the manufacturer of Dengvaxia, Sanofi Pasteur, which actually said that, please correct me if I'm wrong, this could pose severe symptoms to those who have not been previously infected with the dengue vaccine. Yun po yung lumabas nun, number one. That was a number one controversy. And second was because of this conclusion that a number of children or individuals actually died because they were inoculated with Dengvaxia. So let's talk about those two things. Go ahead, Congresswoman.
Well, on the first thing, Sanofi really shot itself on the foot. And let me clarify that. This was a discussion in France. That's why the transcript was all in French. It's a closed-door conference supposedly among scientists because many scientific words, when translated or laymanized, can be misinterpreted. What Sanofi actually said, Sanofi Pasteur, as part of its compliance or transparency, that in the follow-up study, for a few samples, I believe during the time it was around 300 or 3,000, away from the 43,000 subjects of the trial, a retroactive examination showed that in its old definition, severe dengue can happen in 0.0003% of the subjects. However, this severe dengue, if translated to its definition, is an additional 1 day of hospitalization, no deaths. That's the exact quote in the trial.
Congresswoman, I hope you don't mind, no? Tagalogin po natin para maintindihan natin. So sabi niyo po, nung lumabas ang findings ng Sanofi regarding Dengvaxia, it was scientific. This is how I'm understanding what you're saying. At somehow ginawa pong ni layman's po ito. Yung layman's para po maintindihan natin. So ano po ang kanilang naging scientific study at ano ho ba ang kahulugan nito in layman's terms?
Dun po sa follow-up, kasi may constant monitoring yan, nakitaan ng maliit na possibility ng 0.003, I think, or 0.001% ng increased risk of severe dengue sa kanyang old definition. Nang ibig sabihin ay magkakaroon ng isang araw na dagdag ng pagka-ospital sa ilang mga pasyente na hindi pa nagka-dengue. Subalit walang namamatay, kaya ang tinitingnan nila dito ay merong test kit na ibibigay na yung mga nabakunahan o yung mga magpapabakuna, kapag ikaw pa ay hindi nagka-dengue, the possibility of a booster shot is needed. Yun namang mga bansa na kung saan 80% ng population ay na-expose na sa dengue, alam mo man o hindi man, ay kailangang magpabakuna because the risk of dying is bigger. Ang Pilipinas po ay may zero prevalence na 87 to 93%. Kasi tayo nga ang pinagmulan ng dengue ng buong mundo. Kaya lang po, ang nangyari po, may mga kumuha ng excerpts sa internet, pinutol, pinalagay lang yung it causes severe dengue. Pero hindi sinabi na in its old definition, which is actually in the recent classification, it refers to mild dengue, translated ng isang araw na dagdag dun sa mga nauospital. But for a very few percentage. Pero linagay doon, however, yung 90% reduction in deaths, 83% reduction in severity is a lot mas malaki ang benepisyo ng mga hindi namamatay at mababawasan ng 83% yung kailangang itakbo sa ospital. Yun po ay ang mas malawak na benepisyo ng pagbabakuna. Yan po ang lumabas doon sa announcement. Subalit nung dumating sa Pilipinas, pinutol-putol, napunta na sa mga Senate investigation, hindi na makapagsalita yung mga eksperto, and many other self-proclaimed experts were coming out and saying that this is what happened. Kaya naging magulo.
And sino po itong mga self-proclaimed experts that you're talking about?
Well, moving forward, I believe there's no point of discussing it anymore. Ang mas maganda pong pag-usapan that in the new administration, talaga pong magkakaroon ng accountability at responsibility yung bawat doktor na lalabas at magbibigay ng kanyang personal na pananaw. Because part of our responsibility is maganda po na yung mga nagsasalita is not based on their personal capacity, but based on specialty organizations of that concerned problem. Kunyari, problema ng kabataan, tawagan ang Philippine Pediatric Society, magbigay sila ng representative. Kung problema naman ng mga dengue, tawagan naman yung ating infectious disease specialist. Kung problema naman ng COVID, kung mga bata, we have the pediatric infectious disease specialist. Kung bakuna naman, let's actually call the vaccinologist. Kung depende po kasi yan, no? Because not all doctors have some certain some level of expertise, pero wala pong
And
doktor
specialty.
eksperto sa lahat.
So balikan po natin, the numbers that I recall, at least the ones I've researched, is that there were about, during the time that the Dengvaxia vaccine was rolled out here in the country, there were about 830,000 individuals who received this. Let's talk about facts that we know or that you can share with us. Dito ho ba sa 830,000 individuals that were inoculated with Dengvaxia, ilan ho ba ang namatay dahil tinurukan po sila ng Dengvaxia?
Wala po. Patuloy po yan at paulit-ulit na sinasabi ng World Health Organization that nobody died from the vaccine. And Pinky, just to clarify, hindi po nagsimula ang programa sa panahon ko. The study on dengue vaccine started in 2005 and the Philippines became part of the trial kasi tayo po ang pinagsimulan ng sakit na ito at tayo po ang patuloy na nag-e-export dito sa ibang bansa. Nagkataon lang po na nung ako'y nakaupo na, in fact, when I was still undersecretary, in 2014, this was already launched. Nung kapanahonan ko, dun lang po nagkaroon ng pondo And of course,
Yeah.
noong una, ayaw namin dahil walang pera, but when the funds came, it was implemented. The 830,000 children that you were saying, less than half of those was implemented during my time, and the other half was implemented by my successors.
And this is Secretary Duque.
Secretary Ubial and Secretary Duque.
That's right. Okay, we need
And
to
we
take.
have to clarify, Pinky. Sorry lang, let me clarify. Sa buong mundo, kapag merong gamot o may bakuna at nakitaan ng maski isang pagkamatay linked to that medicine or vaccine, biglaan yan, mabilis yan na sinususpend ng buong mundo. Why is it that up to this point of time, 23 countries are continuously using the vaccine? Yan po ang malaking katanungan.
Okay.
At yan po ang sagot na bakit hindi totoong may namamatay.
So sinasabi niyo po, pagka isa lang ang namatay, na it was proven that this particular vaccine was the cause of that death, ipitigil po ito sa buong mundo, at least dun sa countries na gumagamit po nitong particular vaccine na to, whichever vaccine this could be. But sorry, Mama, we just need to take a very short break. Our discussion will continue after this break. Stay with us. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, Congresswoman Janette Garin. All right, Congresswoman, pag-usapan po natin yung where we left off. Sabi niyo po, over 20 countries ho ba ang gumagamit nitong dengue vaccine, Dengvaxia?
Yes, ma'am. At yung sinabi ko nga kanina, it's not only for the countries using it. Pagka merong isang namatay attributed to any medicine or any vaccine, global regulation dictates immediate recall. Ipagbabawal ka agad yan at titingnan, maski duda pa lang. Pero ito, nilagay pa ng World Health Organization sa essential medicines list, where it states that all countries are obliged to make it available to its people at all times.
Yun
Kaya
ang tinatawag na
nagpapakita po yan na
EML.
walang katotohanan sa mga. Yes.
Opo, to categorize it as EML. In other words, essential po siya. Okay, now because of what we are seeing right now, balikan ko po yung una kong tanong. Ang sabi niyo po, government should again, tama ho ba, study this, review it, and the question is, how soon should government seriously look into possibly studying and using, if warranted, this dengue vaccine, Dengvaxia?
Well, let me state a big problem that the universal healthcare law included. Kaya nga po, pati COVID vaccine, hindi mo mabigyan ng license. At parang yung pagka dumating yung ibang mga second generation vaccine, parang mahihirapan ang Pilipinas to avail of it except if the government intervenes because of that provision, that killer amendment inserted into the UHC law. Now, when it comes to Dengvaxia, nagkaroon ng lisensya, it went through the process, hindi totoong minadali. Kasi nga ang Pilipinas ay naging part ng 3 phases ng trials, but it was minadaling i-revoke without the proper step-by-step procedure supposedly because of public pressure. So ang masasabi natin dito, kung kaya bang ibalik, yes, because in the first place, there was really no reason to revoke its license. But again, I am not pushing for it, Pinky, because I might be misconstrued and I might be misunderstood as promoting the vaccine. But on a public health perspective, what I am saying is that if the government will not buy it, at least make it available to the private sector, to the pediatricians, and to the parents who want to protect their children.
But isn't that already pushing it? Because if you're saying, you want to make it clear you're not pushing it, but you're saying that government should make this available to particular doctors so that the doctors themselves can recommend this to the public, hindi ho ba? Isn't that essentially really just pushing it? I mean, you're for it.
Well, yes, because I am being asked. I'm speaking not as an ordinary person, as a doctor, as a trained advocate, and as a mother.
And basically, you're saying not as a congresswoman. Tama ho ba?
Hindi po kasi, yun po ang naging pagkakamali eh. Ang siyensya po should be science. Public health should be left to the experts. Politicians, they can be there for oversight, pero hindi po kasi pwede na pinapakialaman natin ng we micromanage science because that is not the expertise of Congress. We can get resource persons to speak up who should be real experts. Kaya nga nagkaroon ng mga maling provision sa universal healthcare law kasi masyadong nagmedal sa siyensya yung ibang mga legislators.
But because nga, ma'am, yung 90% na pinag-uusapan natin, I want to put this into context though, 90% increase from the same period last year. Undersecretary Vergere made it also very clear. Kasi I asked her, why the steep increase? Number one, she said, rainy season, obviously, pero same period last year. We can assume na ganun din naman po more or less yung panahon. But very important is what she said. Lockdown ho kasi daw tayo last year, and possibly also the previous year. So then I asked her, what about in 2019? Because that might be a better comparison of the number of cases in terms of increases, but we were not able to get into the numbers there. I don't know if you would remember, mataas na ho ba itong numero na nakikita natin ngayon compared to siguro a particular time that you remember when you were health secretary, but of course that was quite a number of years ago.
Yes, mataas po talaga siya. And if talking about science again, Pinky, no, paulit-ulit na sinabi ng World Health Organization that dengue is already of international public health concern. Kaya nga sinabi rin nila na ilang dekada na tayong naglilinis, nagpa-fogging, maraming 4S na strategies, subalit nakita nilang hindi ito sapat, patuloy na tumataas, patuloy pa rin marami yung namamatay. In fact, sinabi rin na while the case fatality rate is going down, ibig sabihin yung porsyento ng namamatay, ikumpara sa nagkakasakit, bumababa, the absolute number of deaths is increasing kasi yung iyong denominator, lumalaki rin. In other words, it was very clear that dengue still does not have cure, it's deadly, and andun yung pangamba mo. Because 80% will not know that they have dengue, the 20% will be symptomatic, but once symptomatic, napakadelikado. Not to mention, the global economic burden of dengue is pegged at around 276 billion 6 years ago. The Philippine economic burden of dengue is around 16.8 billion according to Panlilio et al. Pero kung titingnan natin yung sinasabi ni Yusek Rosette, yes, lockdown no previous year. Are we sure that we didn't have dengue cases? Kasi nga, dahil lockdown, yung iba, pag linalagnat, hindi naman nagpapa-ospital. Yung iba, pag nag-bleed at namamatay, nagkaroon tayo ng maraming problema, no? Na hindi na nagpapakonsulta. But she is also correct because dengue is an illness transmitted during daytime, kung saan yung mga bata nasa school. So nagkakahawaan din doon.
Okay. All right. Again, we need to take a very short break. We will be right back. Welcome back to The Source. Just two more questions, Congresswoman. Isa lang po. If government allows the use of Dengvaxia, how do you think government can build up confidence para po hindi po matakot at matanggap ng publiko ang paggamit ng Dengvaxia?
At this point of time, I think it's best that government reissues the license, the CPR, and allows the private sector to move on with it. Para po walang mali siya. Kasi naiintindihan ko po yung takot ng lahat ng mga doktor, no? Because the scientists, the real experts were not only demonized, but they were also filed up with a lot of cases. So, but then these are the same people and the same scientists also working on COVID vaccine. So, yan po ang medyo mahirap kasi karamihan yan is ayaw nang magtrabaho ng kanilang expertise kapag they need to sacrifice themselves. So, let's push it for the private sector first.
Okay, one last question. Just let's talk about very briefly, have 30 seconds left. Booster vaccines. Kailan ho bang gawing mandatory ito? Dahil napakababa po ng booster rate natin. We have about 50 million eligible population, pero 17 lang ata, or 15 million lang ang boosted so far. What should government do? Should it be mandated?
Well, scientifically speaking, dapat sana, but it's very difficult in our situation because people also have their rights. I believe the problem here is communication. Hindi alam ng taong bayan na yung booster dose is not really a booster dose. It's a third dose. Hindi po naging transparent ang nakaraang liderato ng Department of Health na nagbago ang definition ng fully immunized person against COVID-19 dahil naging mas malakas yung virus. So parang kapag ikaw bahay at sinabi sa yung mag-iiba yung bagyo, palaging magbabagyo, kailangan magdagdag ka ng poste ng bahay mo, kung hindi lilipad yan, hindi po naging klaro ang mensahe. Precise for me to say, the Delta, the Omicron, and the continuously mutating Omicron variants has changed the definition of a fully immunized person. Kaya po mababa ang uptake kasi akala nila protected na sila. So kung wala kang booster or wala kang third dose, wala kang protection. At pwede kang mamatay, pwede kang ma-ICU.
Former Health Secretary and Iloilo Representative Janette Garin. Ma'am, thank you so much for your time.
Maraming salamat po. Stay safe.
You too. And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.